चलेंगी. 72 years old woman present to the clinic with complaints of lightheadedness and dizziness upon standing, which began 2 months ago. She has a history of hypertension treated with a low-dose thiazide diuretic. Upon physical examination, her blood pressure is 138/85 while seated, but it drops to 108/70 mmHg after standing for 2 minutes. Can we have scenario? She denies syncope, but mentions occasional blurry vision during these episodes. Laboratory tests are normal, and there is no evidence of recent dehydration or acute illness. What are the likely causes of orthostatic blood pressure variability, and how would you approach managing her symptoms? And that is for Professor Ejaz, sir. It almost relates to the previous scenario.
We have already discussed about this postural hypotension or the orthostatic hypotension. First, we have to define what is meant by the postural hypotension. So basically, when we take the blood pressure in the supine posture, and then after 1 to 3 minutes of standing, then we have to recheck the blood pressure. If the systolic blood pressure falls 20 or more, and the diastolic pressure falls more, 10 or more, then we will say that the patient is having orthostatic.
And it is advised in recent guidelines to check in every patient this orthostatic hypertension.
So the important point is that when we check the blood pressure in the supine posture, then we have to keep the patient standing 1 to 3 minutes.
Yeah.
And then we should check the blood pressure again. If there is fall of 20/10, then only the systolic blood pressure falls, then we can label that the patient is having orthostatic hypotension. So then we have to find the cause. In this scenario, it is clear that the patient is elderly patient and the patient is taking diuretics. So that can cause
that's a very clear elaboration. That one of the cause can be autonomic dysfunction even at early ages. But here, since it's an old age lady, so probably old age may be the reason. Yes, sir, continue.
So whenever we see a patient with the postural hypotension, then we should assess what are the symptoms the patient is having. The usual symptoms are lightheadedness and blurring of the vision on standing and difficult in concentration. And sometimes if this postural hypertension is much more, then the patient can have dizziness and the pre-syncope or syncope. So in every patient, wherever there is postural hypertension, there are different causes for that one. So the commonest cause for the postural hypertension are the drugs. We have to see the drug history, what drugs the patient is taking, these diuretics, these alpha and beta blockers, vasodilators, they are more notorious to cause this postural hypertension.
Just for our juniors, sir, most of the times our clinics are full of patients. So what exactly are those patients in which they should be checking orthostatic, so especially those who are already on treatment?
Yes, those patients who come with the symptoms and they are already taking the antihypertensive medication and they have the symptoms, then we have to titrate the medication. We have to revise the medication so that the patient should not be symptomatic. The basic thing about the hypertension is that most of the patients are asymptomatic. And the best thing is that they should remain asymptomatic with the treatment. If they will become symptomatic because of the treatment, they will stop the medicine and the compliance will be lost.
So lightheadedness, dizziness, especially related to position change,
with position change.
And guidance to regarding change of position as well, especially old age patient.
So whenever the patient has this symptom, we must check the blood pressure. But the important thing is that the patient should keep standing 1 to 3 minutes, and then that will be the accurate reading for that.
We have time, we can take 2 or 3 comments from any other expert or from audience.
Just a quick comment. Look at the last line, just last para. It says that there is no evidence of recent dehydration and acute illness. Now, remember, this is a 72-year-old lady. Elderlies usually tend to be dehydrated. They do not hydrate themselves enough. So you have to actually sit down and ask them. One point, many times they have got underlying UTIs in ladies. So they do not have an evidence as such available, but there is something pathological going on. So that is one thing. And as far as the need of having hypertensive clinics, that is why it is essential. Because when you've got, as a consultant, you have to go through 20 patients on a rapid pace, you cannot actually spare those 3 or 5 minutes for doing the postural check. Yeah. Thus, the need for an assistant who does it. Thus, if you have a hypertensive evaluation workup done, you have these checklists available which need to be filled up correctly. And then you find out these things. Just a point.
Yes, Dr. Harun.
Thank you very much. I think Professor Ijaz has given a very comprehensive view of this scenario. But I would like to add something like, especially in these patients who are on diuretics, you can say that diuretic is most probably the cause. But especially in this age group, never underestimate autonomic causes. Because these people might be having an underlying autonomic dysfunction.
Combination.
And the other thing is, these people always who are on antihypertensives in this age group, and this is what is happening, they always need 24-hour ambulatory blood pressure monitoring.
Variability.
Because you are not only getting the values of the blood pressure, but at the same time you are getting the heart rate.
Rate variability.
Because we have to observe when the blood pressure drops or goes up, what is the heart rate. So this is, will show you something else as well. Thank you. Thank you very much.
Agree. Any comment or question from the audience? Yes, Dr. Akhtar Bandesha.
Of postural hypotension and all that. So the in the workup of that, and especially the younger people, we should not forget the tilt-table test to see, as Dr. Babar has mentioned, that it's a bradycardia, it's a mix of hypotension and bradycardia, or it's just bradycardia, or just hypertension. So that will help in the management of the disease. And do not forget the role of postural exercises actually in the management of this. Not in this particular scenario, but otherwise in this.
Very rightly added. The objective of the session is to generate these uncommon things which sometimes really bothering the patient. Yes.
सर, ये जो अभी हाइपोटेंशन की बात हो रही थी, आर्थोस्टेटिक हाइपोटेंशन की, तो इसमें हार्ट रेट की अहमियत होती है, ऑटोनॉमस वर्सेस अदर काज. तो इसमें हार्ट रेट, मगर पहले में जो हार्ट रेट वेरी कर रहा था, तो वो जो वेरी करता है तो वो तो ऑटोनॉमिक नहीं हुआ ना. तो ये थोड़ा सा करना है.
Thank you, ji. Let's move on to next scenario.